Hi, and welcome to the show. Subscribe at kevinmd.com/podcast and get CME for this episode by clicking on the CME link on the show notes. Today, we welcome back Francisco Torres. He's an interventional physiatrist, and today we're going to talk about his book, Dr. T's Drop the Fat Diet, 12 Steps to a Leaner You Forever. Francisco, welcome back to the show.
Well, thank you so much for having me at your program, Kevin.
So Francisco has been on multiple times. Go to kevinmd.com/podcast, search bar, search for his name for his prior episodes and hear his story. But today, let's talk about your new book. So before talking about the book itself, tell us about the events leading up to it. Why did you decide to write a book like this?
Well, as I told before in my previous podcast, I had issue with my body image. I was not healthy. It was not until when I was in my early 40s that I suffered a cardiac scare. It was nothing major, but it forced me to make a decision. So I changed dramatically. And then since that time, I have gone up and down, changing different ways of training and dieting. And then I wrote that first book to tell my story. So it was more focused on my before and after pictures. So I thought that after 7 years, I said it's time to just change that approach before and after. I think it looks just too cheesy, to be honest with you. And I decided to come up with a new revised edition with a little bit more science and more experiences from my own journey.
All right. So your book is, I see the book cover behind you there, Dr. T's Drop the Fat Diet, 12 Steps to a Leaner You Forever. So tell us about this book. What makes it different from all the other diet books that are out there?
Okay, but first of all, like I said, I'm the poster boy on that one because I'm just telling everybody my experience. And it's interesting, Kevin, that my patients see me so fit and they question my ability to empathize with them. They say you're so in shape, and I had to put it on a book so they understand that I was not like that before, and I still struggle during the pandemic. I gained the weight, and so I rewrote my program too based on my experience that during the pandemic I gained extra 20-30 pounds. So I'm trying to make it more real, and then what I'm trying to do is combine the science by the new research and the new things coming up and kind of apply that to 2024.
So tell us some of the 2024 data that's affecting diets today.
Yeah, the thing I when I wrote the excerpt on your site is that I concentrate on the Ozempic and the semaglutides because it's the new thing. Everybody's talking. All my patients are on semaglutides and they are losing the weight, but unfortunately, it's not equal to be fit. And these people are looking for a quick fix, and they are forgetting about their exercise, the lifestyle. So I always say the scale doesn't tell you that you're fit or you're healthy. It just tells you a number. And I think that what I try to do with this new book is the approach is weight loss is a side effect of proper nutrition and exercise.
Okay. So when you say proper nutrition, tell us your approach for that.
Well, my approach is like if you look at all the diet books that are effective, they work as long as you control the amount of calories, the quality of the calories, and also the frequency. And then the thing is, there are so many different ways of doing it, and if they work, it's because you're doing something that is only more customized to yourself. I like for example, I think I have had this discussion, and it applies to me too. We're looking for something that is easy to do with not too complicated, that it fits your lifestyle. For example, prepare meals, or when do you eat, or do the intermittent fasting because it's a little convenient and we know it's effective. So I try to explore all of that based on the patient's need. It doesn't apply to everybody. Not everybody likes to or can afford to buy prepare meals. Or no other people they don't want to skip breakfast, so for the intermittent fasting. So it's a little bit more customized. And it's interesting, Kevin, I was reading an article that they're, and the headlines always are very dramatic, like a pill to mimic exercise. And I think that's very attractive, but it's still, you cannot replace the effort and the knowledge too. Why are you doing the thing that you're doing? But now in my book too, this time I talk a little bit about drugs too, like metformin. I'm a big advocate of metformin because for the anti-aging effects, I know it's natural, the French lilac, and I know one of the things that sold me is because it says it mimics intermittent fasting. So when I read that, I said, oh, because I sometimes have a hard time keeping that intermittent fasting. But said, well, I have my metformin, I'm okay. So, but that doesn't substitute my conviction about exercise. And when I start eating proper nutrition, not like I can eat whatever I want.
So it doesn't sound like you have a single prescribed diet. You really get a sense of the patient's story, and your nutritional advice is customized based on their lifestyle and workflow during the day. Is that right?
That is correct, especially in my field that I do pain management. The first thing that people say is, "Oh, I cannot exercise, I have back problem." And I try to educate them that the weight is not from exercise. You don't lose the weight from exercise. So and then most of the time, just like one sentence or something, and they open their eyes. Oh, I didn't know I could do that. So it's a lot of education and customize the care to them, not one diet fits all everybody.
So give us an example or a story of how you counsel one of your patients when it comes to weight loss and nutrition. Give us a success story where you move the needle in that patient's case.
Well, I can tell you, I had a great case and a 70-something-year-old gentleman, overweight. He had tried bariatric surgery, and after the bariatric surgery, he won even more weight. And he had back pain with radicular symptoms. So nobody wanted to touch him because it was big. And I questioned myself, so I cannot do an epidural injection. I don't see the needle. But I took the chance, but I sat down with him and I said, you're going to end up in a bad situation. If you need surgery, it's going to be so complicated because of the size of you. So I sat down with him and I asked him, what is really your issue here? And he discussed with me his problem with, cooking meals, about his doubts about exercise because he was so big, and the frustration that because he had the bariatric surgery and didn't work, he was a little bit depressed too. So we talk about simple things that he can do. So I said, let's go baby step. So we created a very mild exercise program at home dedicated to him. And then we start talking about with him, we talk a lot about ketogenic and the intermittent fasting, and that would really work. And at the end, he has lost, and this is probably almost 10 years ago. He's fit, he's exercising more frequently than me. He's full of energy. He's very happy with that. And he had been that one of the things that I try to sell is long-term result, not quick fix. Anyone can lose 30 pounds and then, say, wow, and then gain the weight back again.
So you mentioned intermittent fasting a few times. Tell us more
Yeah.
about that.
Well, the intermittent fasting, I like the concept because it simplifies your life. People who tell me they don't have time to eat or they don't have the money, they say, look, but this is beautiful. You're incorporating here calorie restriction, which we know is associated with longevity. So it saves you money, and also it's easy to do. The only thing that you have to be sure that the patient understands how they're going to break the fast. You have to do it with a protein. You cannot just do it with whatever. And you cannot go crazy and eating whatever you want. You still have to be very conscious about what you're going to eat. So I tell them, look, if you're going to do the intermittent fasting too, you have to stay with it. You cannot do it one day yes and one day no, because it doesn't work. But the results that we have seen with diabetic patients, fantastic. And I think for me, it's pretty easy to follow once you are committed to do it.
So what's your opening step when it comes to intermittent fasting? What would be the first step for patients who are interested in that approach?
Well, I tell them, that, first of all, to be committed that this is a long-term process. It's not like you can do it one day, not do it that. So I have to say, and then they have to choose. They're very carefully, and I talk to them about what 8 hours are they going to choose to eat. Because if you have a party or something, or you have an activity, or have people who work at nighttime, so we have to first figure out the time. Once we figure out the time, we know that we cannot break the fast. We explain to them, you can have coffee, black coffee with no sugar. So we talk about options to keep them entertained. And then once they break the fast, they say, we have to go for a protein. So you have to have a piece of chicken or fish or something available. So be prepared to be successful.
Now, do you start with 7 days a week? Can someone start 2 to 3 days a week first? What's your approach with that?
Yeah, it depends on the patient. I know that people are committed, they want to do it fast. I'd say that minimum 5 days.
Okay.
That's my number to look for. But so they have the weekend to kind of be a little bit more, because during the weekend when they have functions, parties, or they go to the restaurant, so it's a lot easier to do it only during the weekday.
Okay, so we talked about diet, nutrition, exercise. What is the role of medications like the Ozempic? So what
Yeah.
is the role of those?
The thing is, the medications are wonderful. I think they're wonderful drugs. Now there was a new article reporting that it blocks inflammation.
Mhm.
So they're talking about the bad side effect. people opinionated, but there's good side effects too. The main thing is my experience with dealing with clients is that they don't know how to stop. They need to have some type. In the past, we used to use phentermine to try to stop but that didn't work. The appetite, the side effects, and it didn't really was long lasting. This one, I feel that it stops the cycle, restricts your eating. There was somebody mentioned, I don't remember what it said, which it was funny that he said, wonderful drug. I think it was a surgeon. Wonderful drug, but it took away the pleasure of eating. So you're gonna have to be prepared for that. If for you, me coming from a Spanish culture, it's big to celebrate with food. We always celebrate with food. So if you're gonna take away that pleasure, it's like you have cancer. You lose the weight, but you feel very lousy. So you have to understand that. And the other thing too is this medication. Once you start, you cannot stop. I don't think that there is just for a period of time and then you stop it, because if the majority of patients gain the weight back again. So I think that also maybe the reason they're gaining the weight back is because they're not doing their exercises, they're not changing their mindset. That's basically what I always say. You have to change your mind in order to be successful.
I've been told that when you start these GLP-1 inhibitors, that you have to reframe what you think obesity is and treat it more like a chronic disease, like you do with diabetes and hypertension. Is that
Correct.
right?
Correct, exactly. And then you have to deal with the side effects. There's going to be side effects. When I talk to the patient, I want to know what they're looking for, because if they're just because of it's a high school reunion, will not use Ozempic for that, But if it's just somebody who had dealing with problems, joint pain, a lot of other issues, yes, that may be a good candidate.
Now, your book also has some recipes in it. Is that right?
Yes, I try to coordinate, because people ask me, well, what do you eat? What do you eat? So I try to put it together, and also simple recipe that you can cook very easily,
So
very
tell us
easily.
about what kind of recipes. What's the philosophy behind
Well,
some of these recipes?
the philosophy, I'm a little bit more biased too, with a little bit of the Mediterranean ketogenic. So I try to restrict the bad carbohydrates, okay? But I always tell a patient, but remember, fruits and vegetables are carbohydrate, but they're good carbohydrates. So I try to add that to, but always a little bit higher on the protein side.
How did you come up with these recipes? Do you have a cooking background? Are these foods that you normally eat?
There's a couple of things. I have a couple that I had from the family recipes that because of the Mediterranean background, which I thought were very healthy. And then throughout reading, and I joined other groups that they have nutritionists on board. So we have worked together to create some recipes. As a matter of fact, which I haven't published, I have a full cookbook. I'm trying to see if I can publish that one, but that one was a little bit more with a lot of pictures and the quality and the amount of carbohydrates and protein and all that and calories.
Now, for those readers, after reading your book, what are some of the other main messages you want them to come away with?
Okay, the scale doesn't tell you if you're fit or you're healthy or not. We need to stop looking at the scale, and I'm against the BMI. It's just we're using something that is not accurate. It's not really telling you what's going on. And I think that my message to the patients is be sure that you know why you want to change. If you don't have that solid, it's not going to happen. And you need to start thinking the way you talk to yourself and the way you behave, it says a lot. So you have to pay attention to your psychology too.
Now, if we don't use the scale, what objective measures do you recommend?
I'm big with fat percentage, muscle mass, and also the waistline. For me, what guides me when I know I need to lose or what is my waistline, my belt. If I have in my mind, it was funny because a Seinfeld episode, he was changing the tags because he wanted to stay on 32, and it's kind of funny, but it's real. If you start assuming, okay, I'm okay, but the pants are not fitting, there's something wrong, because that really tells you about the abdominal fat. For me, that's more reliable.
Now, when it comes to measuring fat percentage and muscle mass, any tools that you could recommend people
I
get to
normally do
measure
that.
that?
Yeah, I normally do the DEXA scan when I have somebody I need to be. And then there's other tool that you step on the scale and give you indirectly the fat percentage. The one I use in my home is that the scale with the impedance. And again, what you have to do is have a number and work with that number, which is only your number. So that's what I always tell my patient.
We're talking to Francisco Torres. He's an interventional physiatrist. His book is Dr. T's Drop the Fat Diet 12 Steps to a Leaner You Forever. Francisco, let's end with some of your take home messages to the Kevin MD audience.
I think that my number one will be that get educated, know that there's many different options, and be sure that whoever is working with you knows every single detail about your own person, that all that what pertains to you. Like we do blood work and we're going to decide on the treatment for that. So that's what I say. Try to get as many measurement marks so you can know if you're making progress or not, and be sure that once you are there, your mind is set to be as successful.
Francisco, thank you so much for coming on the show, sharing your time, insight, and perspective.